Hello, my name is Matthew Reish. I'm an orthopedic surgeon, board certified, fellowship trained with Sun Orthopedics of Evangelical. Shoulder replacement surgery, which is what we're talking about today, is an operation that requires the replacement of a degenerated or diseased joint. So the shoulder in its basic form is a ball and socket, and you're replacing that with metal and a special type of plastic called polyethylene. And that restores the function, mobility, and really the biggest, most satisfying part of a shoulder replacement is the pain relief that it provides for patients. A lot of patients with shoulder arthritis end up having pain, a significant amount of stiffness, and just they lose function. They can't do basic activities of daily living. They can't do things that they enjoy doing outside of the house, golfing, leisure activities, hobbies, hunting, fishing, etc. And when you get to a point where a shoulder replacement is a consideration, you've kind of gone through a lot of different types of treatment. Some of those treatments can be physical therapy, medications, which are effective at controlling some of the symptoms that are associated with arthritis. Injections can play a role in decreasing, again, inflammation and getting pain under control, or acute flare-ups. A lot of patients who have arthritis kind of have this insidious onset where they start getting a more painful joint, a stiffer joint, and it just kind of keeps building until it becomes no longer tolerated. But also, I see a fair amount of patients who will have some arthritis that's been there for a while and they don't really have symptoms, but they develop symptoms acutely. So they have kind of a twisting or an injury where that just creates symptoms in an underlying arthritic shoulder, or any joint for that matter. So the goal of getting patients better is to, treat the symptoms, use medications that are appropriate, use injections to kind of temporize things, deal with acute flare-ups, perhaps buy some time. But ultimately, if patients have end-stage degeneration of the shoulder replacement's a very effective form of treatment. This really is an excellent surgical procedure for end-stage arthritis of the shoulder. Patients who have arthritis, the cartilage that allows normally a nice smooth gliding surface is completely worn out. And so you have this rough bone on bone feeling, and patients feel that. They feel the crepitus or the grinding, the grating, and it limits their motion so they get stiff. They don't want to use their arm. And at the end stage of that, it's just sleep disturbance. They have trouble rolling onto the shoulder. They can't do a simple activity where they're reaching away from their body because of the pain. And that creates weakness. You don't use your arm and you're just kind of holding it in because it's painful. Now your muscles are atrophying. So not only are you stiff and have an arthritic joint, but you're weak and your function just kind of goes down the tubes. So really, this is a very highly successful operation for relieving pain as the primary goal. And even in patients who have a tremendous amount of stiffness, if you get rid of their pain, they're extremely satisfied. And if they have some residual stiffness, which can happen if you have a very stiff shoulder going in, having the pain be gone allows them to function better, to be highly satisfied from the operation, and even accept some of that motion loss. Although a lot of times, because of the pain, once that decreases and diminishes and goes away, they restore a lot of their motion because now they're able to use their arm more, and their function improves. So that's really the goal. My goal with this operation and treating patients with shoulder problems in general, whether it's arthritis, rotator cuff tears, instability, is to take someone who is not able to do what they want to do. Their function is limited. They're having pain, they're having dysfunction, they're limited at work or their hobbies or their athletics or whatever the case may be, and get them back to doing that actively so that they can maintain a healthy lifestyle and ultimately get back to what they enjoy doing.